Having a baby can be a very happy time, but it can also be a very scary time for new mothers and fathers. Now, one hospital in Albuquerque has something that will help those parents and babies. Here with us now is Dr. Emily Sebesta to tell us more about baby-friendly certification. So this is a new thing that UNM Hospital is doing, and it's what exactly is baby certification? What does that mean for families?
So baby-friendly is actually it's a World Health Organization, UNICEF certification, and it started in 1991. And what it is if hospitals follow these 10 steps to successful breastfeeding, then they can become certified to become baby-friendly. And it's designed to make sure that hospitals are doing the best that they can to help moms be successful in breastfeeding.
Okay, so if expectant mothers out there, we're not quite sure where we're going to deliver,
Right.
looking for a hospital that is baby-friendly certified, very important.
I absolutely recommend that women should look for a hospital that is baby-friendly certified. And there are now 2 hospitals in New Mexico. One is Mountain View down in Las Cruces and Zuni. UNM is in the pathway. Presbyterian is also in the pathway. Several hospitals are. So
Okay.
I think things are changing.
So what is required for a hospital to become baby-friendly certified? What are those steps?
Okay, so I'm not going to go through all the steps
Sure.
because that would probably take a long time,
Sure.
but I think the ones that matter most to moms are that the baby not be given anything else except for mother's milk unless there's a medical reason. Right after birth, the baby should go skin to skin. I think we were talking about that before because your daughter got to do that, which is great. So babies should go skin to skin, and they should be allowed to stay with the mother and breastfeed in the first hour. They should stay with the mom throughout the hospital stay unless there's some medical reason for them to leave mom. And then hospitals should train all of their workers to be able to follow these paths and help moms and assist, and then give moms resources once they leave the hospital.
Right. Now, why is it so important, just so folks may be unfamiliar with this, why is it so important for skin to skin to happen as soon as possible?
Right. So skin to skin is it's amazing. It's kind of new in the sense of my oldest child is 14 and nobody ever thought about it. You know, they wrapped him up, gave him to you in a blanket, but it's intuitive. It's the way things were done for so many years. Of course, it's the natural way, and now there've been plenty of studies that show if a baby is skin to skin with a mom in the first hour, the baby will on his or her own go up to the mom's breast and latch in that first hour. And babies who go skin to skin, they regulate their temperature better, they have lower rates of hypoglycemia. The mothers whose babies go skin to skin, they tend to breastfeed longer. They tend to be more successful exclusively breastfeeding. In fact, I think it's 6 times greater.
Really?
Yeah, it's pretty huge. It's monumental. And then if you look at like babies at a year out, moms who had their baby skin to skin, even for just 15 minutes in that first hour of life, they show more positive words with their babies, more touch, just more maternal affection.
Great, okay.
So it really
And of
helps
course,
with bonding.
And you know, as you were talking about breastfeeding, of course, a lot of people go back and forth on this in terms
Right.
of what is good, what is bad.
Yeah.
What are the benefits to breastfeeding versus doing formula? Is it possible for us to do both?
Right. Well, the benefits, we would have to have about a 2-hour talk, maybe longer. Maybe we would have to do a seminar for a week or so to talk about all the benefits. But I think most people know that babies are healthier if they're breastfed. Moms are healthier, reduced risk of cancer, reduced risk of heart disease. The list goes on and on. Can you do both? I don't recommend it. I think eventually a lot of us end up having to supplement. We go back to work. It's hard. It's really important not to supplement in that first few days of life.
In the first few days.
It really is. That is when, as one person put it, the baby's putting in the order for milk to the mom. And if you
Gotcha.
don't do that, if your body's not receiving that signal, you don't make as much milk. And again, studies show that you are much, much less likely to be successful breastfeeding if you get supplemented in those first 2-3 days of life. If you have to do it later, if you choose to do it later, that's fine, but you really want to avoid it when you're establishing breastfeeding in the first few days.
Gotcha. Okay, so really important
really
early
important.
on, because as you
Right.
said, you're programming the body. The mommy's body is being programmed to give what new baby needs. So as you said, a lot of families going back to work, they have to do this. Are there
Right.
things that employers and other organizations can do to help mothers, new mommies, facilitate this?
There are lots and lots of things. I mean, I think for the average person on the street who may think, well, I'm not an employer and I'm not a doctor, how can I help? Just smiling at a mom who's breastfeeding in public, just giving her kind of the, it's okay, we appreciate you're doing this. Employers, we really recommend that they have a policy in place so that everybody knows, not just the people who might be having a baby, but that everybody knows, hey, we support breastfeeding. We think this is important for our employees. Have a policy, allow moms to take break time to pump, and it's actually federally required. It's mandated by state and federal law. But so giving women the time to pump, and you miss less work. You miss less work, so this actually benefits everybody. Nobody loses with this scenario. And then as far as the community goes, again, you know, smiles, places for women to breastfeed. And this is an interesting one for me because I don't want women to ever feel like they need to go into a back room to breastfeed.
Right.
And I don't think anybody should feel like they have to do that. On the other hand, there are some women who are not comfortable breastfeeding in public, and that's fine. So there should be room for women who feel comfortable breastfeeding in public and for those who don't.
That's great. Well, doctor, thank you so much. Very important information. We, of course, will have more information on our website at casa.com. Just click on the Style tab. Thank you so very much.
Thank you very much.
Absolutely.